What is frostbite? Frostbite is an injury caused by freezing of the skin and underlying tissues. It's most common on the fingers, toes, nose, ears, cheeks, and chin. Exposed skin in cold, windy weather is most vulnerable to frostbite. Do you know how frostbite feels like? So, it's the numbness or pain after exposing part of your body to extreme cold. And what can make it worse? So, having had the exposed area wet while also cold. And what can make it better? So, removing the exposed area from the cold. The first stage of frostbite doesn't cause permanent skin damage and can be treated with first aid measures. All other frostbite requires medical attention because it can damage skin and underlying tissues. Moving toward the symptoms of frostbite, if your skin has been exposed to the extreme cold for a long period of time and appears hard, pale, numb, waxy skin, and insensitive to touch, you may have frostbite. Red, white, bluish-white, or grayish-yellow skin. Clumsiness due to joint and muscle stiffness. Blistering after rewarming in severe cases. Now, the question that you need to ask your patient before making a diagnosis is that you need to ask the patient about how many previous tetanus shots you have received, and if the exposed area is numb, blue, white, or painful. Now, you have to examine the patient. Well, this physical examination includes skin exam to check the extent of frostbite and how well you can feel in the exposed area. Now, moving towards treatment, and treatment for frostbite depends on its severity. Skin that is white and insensitive to touch may be severely frostbitten, so if you believe you have experienced severe frostbite, seek medical help immediately. If help is not readily available, place affected areas in warm, not hot, water or cover them in warm clothes for 20 to 30 minutes. Wrap the affected areas in sterile dressing. Try to keep them immobile. And drink lots of fluids. Allowing the areas to refreeze could be very dangerous, so only begin the thawing process if you are sure the area can be constantly kept warm. Prescribe medicine for pain, such as ibuprofen, that will help reduce pain and inflammation. Apply aloe vera gel or lotion several times a day. For more severe frostbite, you may loosely wrap the area with sterile dressings to protect the skin. You may need to elevate the affected area to reduce swelling. To heal properly, frostbitten skin needs to be free of damaged or infected tissue. Therefore, you may need to remove some tissue. Soaking in a whirlpool bath can aid in healing. Antibiotics may be prescribed to protect against infection. Medications that help restore blood flow to damaged tissue also may be prescribed. So, now, if you are clear about your findings, you can manage your patient accordingly or do further investigations if required. That was all about the differential diagnosis of frostbite. Stay tuned to sqadia.com for more such precise and knowledge-stuffed videos.